Hi Radiant Beauties. Today I want to talk to you about something that's very important that a lot of people, even doctors, overlook, and that's vitamin D. So vitamin D is actually a misnomer because vitamin D is not just a vitamin, it's actually a hormone. So it turns out that a vitamin is something that you actually have to ingest. So a vitamin is a vital amine, which means that it's something that's so essential that your body cannot make, and you have to ingest it, you have to eat it in order to be able to get it. So for instance, vitamins A, vitamins C, vitamin B, vitamin D can be made in the body. And you know the organ that actually makes vitamin D? The skin. The skin is the largest organ in the body, and Mother Nature placed the mechanism to make vitamin D in the skin. So anything that can be made by the body is called a hormone. So vitamin D is also a hormone, but in certain instances, it is a vitamin. So a vitamin is something that cannot be made by the body, that has to be ingested, which means you have to take it as a supplement. A hormone is something that can be made by the body. So now, in what instance is a vitamin a vitamin? So for instance, in an instance where someone cannot receive sunlight, so a darker skinned individual, the melanin in our skin actually prevents us from being able to utilize ultraviolet B from the sun to make vitamin D. So if you are darker skinned and you go out in the sun, you're not going to be able to make vitamin D as efficiently. And those of us that live in North America or in the Western Hemisphere, where it's actually not as sunny, or we're not outdoors for as long because it's very cold, or those of us that have been stuck indoors because of COVID, we haven't been getting as much sun exposure. So we've been getting very little vitamin D. So in this case, it's actually a vitamin, which means we have to be supplemented. And what's happened also last year, many of us actually did not go to the doctor's office. We only had televisits. So we did not get the blood check or the blood draw. That actually, that's the only way to get the blood levels of vitamin D checked. So make sure you are going to your doctor's office. Make sure you are getting your vitamin D levels checked so that way you are not deficient. Vitamin D is very, very important. Don't forget, vitamins are things that are really, really vital for the proper functioning of your body and your immune system. Now, let's talk about the hormone aspect of vitamin D. In the situation where you get a lot of sun exposure and you're able to make vitamin D in your skin, you can actually make vitamin D in your skin, and your body can convert the vitamin D you make in your skin in the kidneys and in the gut. They convert it into something that can be utilized. Now, vitamin D is very important, and vitamin D has receptors, which means vitamin D is actually able to dictate or determine the functioning of a lot of organs. So a lot of organs that you already know about, for instance, the bones, we know that vitamin D is important in bone health. So if you want to have strong, healthy bones, you should definitely take your vitamin D. And also the bone marrow. So the bone marrow, that's where your blood cells are made. So guess what actually also becomes the immune cells? The blood cells become the immune cells. So the immune cells are made in your bone marrow. So if your vitamin D levels are low, you could also have abnormal immune cells. So your immunity could be affected. So that could be the connection between having low immunity and having low vitamin D levels. The vitamin D levels also affects the functioning of your thyroid gland. We all know that your thyroid gland is a master gland, so it's like the thermostat of your body. Even if you have fuel in your heater, if you don't have a thermostat on, your heater is not going to work. So your thyroid gland is like your thermostat. So vitamin D is important in the normal functioning of your thyroid gland. So if your vitamin D levels are low, your thyroid gland is not going to function properly, so your hair is going to fall out. And a lot of times people come into my office, they have hair loss, and we check their thyroid gland, and their thyroid hormones might be normal, but their vitamin D levels are low, so we have to actually put them on supplementation. So, and so on and so forth. Vitamin D also has been implicated in mental well-being. So people with sometimes feelings of depression or clinical depression, if their vitamin D levels are low, they could actually benefit from supplementation of vitamin D. So now what I'm actually telling you to do now is make sure you go to your doctor's office, make sure you get your blood drawn so your doctor can check your levels. If your levels are lower than 30, so the normal range is 30 to 100. If your levels are lower than 30, you may benefit from vitamin D supplementation. Now, when you want to get your vitamin D supplementation, make sure you take vitamin D3. Okay? Now, there are two other vitamins that actually helps vitamin D3 get absorbed really well. That's going to be vitamins A and vitamins K2. So vitamin K2 and vitamin A. So those two vitamins actually help to make sure that vitamin D3 gets absorbed very well in the gut. So I hope this has helped. If you love what I've just said today, make sure you like, comment. I want to hear from you. And don't forget to subscribe. And also hit that notification bell, because I'm going to be having lectures like this every week to educate you about the intersection between skin and health. So I hope to see you next week. Bye-bye.